Hey everybody, today I want to talk to you about nerves. Now, the question is, have you ever had your leg or foot fall asleep? Of course, everybody has. You sit the wrong way, you cross your legs, and next thing you know, one of your feet, you don't have any sensation, it's fallen asleep. Why does that happen? And a lot of people say, oh, it's because I cut off circulation to my leg and now it's not getting any blood and that's why it went numb. Well, that's not the whole truth. The truth actually is that there's compression on a nerve. A nerve gets pressed and the signal that comes from your leg to your brain is blocked or interrupted, and brain can't feel the leg anymore and it goes numb. Now there is a circulatory component to it with blood, but it's more because of the nerve, not circulation. And so what do you usually do? You change position, you move the leg, and the signal gets restored. Pressure comes off the nerve, the foot starts to return back to normal. Well, that same thing happens in the entire body. In fact, you have a nerve that goes to every cell, every tissue, and every organ in your body. Everything that happens in your body is because a nerve connects it to the brain. All power, health, healing comes from the brain, above, down, and inside out. So if nerves are free from interference, your body should have the best health it's ever had. Everything should work properly because it's communicating with the brain properly. If that nerve pressure, however, is on a different body part, not something that has a sensory component, but something that's purely designed for function. For example, a liver, a heart, or the bladder. Those organs don't necessarily go numb when there's pressure on them, but they work differently. They start to malfunction, and depending on the amount of pressure on that nerve is the amount of malfunction. So an example I'll give you is we had a patient, a little boy came in, parents brought him in because he's having bedwetting issues. He has accidents every single night, every night for a couple of years. It's a big problem. So what we did was we analyzed the spine and we found that there's actually pressure on the nerve at the bottom of the spine, and that's the nerve that goes to the bladder. So we adjusted the spine to move the bones to release the nerve, to take pressure or irritation off the nerve. And he started to sleep through the night without having any more accidents. His bladder started to work properly because now it's connected to the brain. Every organ in the body needs to have that communication. Hope that helps you.